Barba. I'm the Executive Director of the Pennsylvania Chiropractic Association. Today, we have one of our really valued strategic business partners back with us today, Impact Health Sharing. Impact Health, Richard and Trey have been with us for now over a year, and we've been very pleased with the services that they've been able to provide to our clients, provide to our members, and really developing a process where we can break out of the insurance mold and some of the high costs associated with going through other insurance providers, and are actually able to connect and maybe even bring insurance for our staff and other opportunities. So today they're here to talk about more opportunities that are available to you through your Impact Health relationship. So I'm going to introduce Richard and Trey. They are the team behind Impact Health. They are the team that has been working with us, and they're going to be coming to our conference again this year to try to establish more of an opportunity for you to take control of your insurance costs. So Rich and Trey, thank you for being here.
Thanks, Mike. Nice to see you. And we've got something that we're really excited about as Impact continues to grow in so many different directions. We're getting a sense that they're becoming as much of a option for non-traditional healthcare coverage, but they're becoming more of a wellness company. But we'd like to share some of the benefits with the preferred provider, which really impacts the practice in a way that continues that theme about profitability and growing your practice. So some of the highlights right now is if your patient becomes a member of Impact, that is 50 chiropractic visits per family member. And that is really interesting. And we have some things to help get you there. But Trey has the video that's going to show the real benefits of this provider program.
As a healthcare provider, your focus is on delivering exceptional care to your patients. But the complexities of the health insurance industry, slow payments, denied claims, and burdensome billing requirements create unnecessary obstacles. At Impact Health Sharing, we believe healthcare doesn't have to be that complicated. As a not-for-profit, modern healthcare sharing community, we're reimagining how providers and patients work together. Since 2020, we have saved and shared over $275 million in eligible medical bills, and we're proudly serving more than 18,000 lives and counting. As an Impact Preferred provider, you'll enjoy fast, reliable payments. Our industry-leading billing process ensures payments are made within 30 days or less. No network requirements. Impact members can choose any licensed medical provider, giving you flexibility and access to more patients. No utilization reviews dictating care. We trust your expertise. Reviews only confirm sharing and pre-existing eligibility per our guidelines, so members receive the care they need with clarity and confidence in their financial responsibility. Increased visibility. Your practice will be featured on our member portal, expanding your reach to our diverse member base. Fair market rates. We're committed to offering competitive rates that benefit both providers and members. Transparency and ease. Our streamlined claim process with electronic submissions and access to our preferred provider services team ensures a smooth experience. We want to help you and your team spend less time on paperwork and more time caring for our members. Getting started is simple. Just complete the preferred provider form on our website at impacthealthsharing.com/providers, and one of our team members will reach out to answer your questions and discuss our contract terms and fair reimbursement rates. Once on board, you'll have access to the online provider portal and support team, ensuring that your medical bills are processed quickly and correctly every time. Become a preferred provider today. Visit impacthealthsharing.com/providers to apply.
That was great. And one of the things that's interesting is I think some people, they would go, of course, I'd want to take Impact Health if I'm actually using Impact Health myself. There's more of an opportunity here, guys. So let's talk about that. What exactly is the opportunity behind not only becoming a provider, meaning that you can take Impact Health at your practice? And I was very impressed with the shorter payment time. I hear from a lot of chiropractors that they get raked over the coals sometimes in regards to payments taking longer than they should, authorization issues, and it seems like this really streamlines this process. So why don't we get into the nitty-gritty a little bit more about this? Who would like to share with us more about how this works and what the benefit is for the Impact Health, not only being an Impact Health, using it for your own personal insurance in your practice, but taking it and introducing it to patients?
Mike, with our time with PCA over the last year, one thing we've definitely realized is the struggle chiropractors have with traditional insurance, getting paid on time, keeping customers and stuff like that. So here we have a product that not only benefits the practice of the chiropractor, but their customers as well, which is the most important thing for a chiropractor. And with those 50 visits a year, more people are going to be coming to your practice more often. 15 days to get paid, that's not bad compared to even arguing with the insurance companies to get paid instead of paying out of pocket by the customer, which can be annoying for both parties. So it's technology platform really plays the biggest role in what makes this so great for both parties. And it's something that's growing very quickly in the chiropractic community. And we're excited to see just how far this will inflict the PCA, its members, and the customers nationwide.
Yeah, we've prepared some PDFs to assist in carrying that message inside the practice. So we have some 11 by 14 sharing some of the benefits that could go into the examination rooms. We have trifolds that could sit at the receptionist desks. We have other marketing things that can assist to carry that message. And then Trey and myself, we're here to do the heavy lifting. So if there's questions or having a patient actually enroll, we've got the backstop to catch all of those. But if we talk about that preferred provider, it's really a cash flow kind of opportunity where you're, and hopefully at the end, you're eliminating insurance companies. And I don't know that true impact of enhancing cash flow, but that is making your practice more profitable.
So let's talk about the mechanics, if we can, of this. A person is introduced to Impact Health through their PCA membership. Not only do they tell other members that they like this, but they tell non-members that they may be connected with about the benefits of Impact Health, other chiros. Other chiros see this as a real benefit for them within their practice and within positive influence as it's portrayed with their staff and employees, if they're able to cover them as well or get them involved in Impact Health. So the natural thing that happens, especially for an employee, a staff member who may be interacting with the public, having to take payments, having to take co-payments, go through this whole process, they inevitably are getting asked, boy, this copay is so high. Oh my gosh, it's such a headache to go through this. Or maybe even being told that, listen, this is your 10th visit and therefore you don't have any other visits that are technically covered. And so the price might change and what have you. And that makes a really interesting transition for the chiropractor to be a benefit to their patients by introducing them to the alternate that could be Impact Health and how it could work for them in their future. So can you guys share and dig into that a little bit more and tell me what benefits you've seen, what stories you've heard about Impact Health being introduced to patients, and how in the long run, it's a real benefit to not only the practitioner, but to the well-being of patient and patient's access to chiropractic care.
Absolutely. One of the biggest benefits we've seen with our time with Impact, especially in the chiropractic world, is there is a viral aspect of this. So someone will go to their chiropractor, see PCA or Impact, and be like, what's this? And unfortunately, in today's world with rising healthcare costs, it's a big discussion point. So people be like, oh, what are you on? Be like, my chiropractor had something called Impact Health Sharing. So now they're telling their friends about it. So that friend might go see that chiropractor, bring more business in, and it just spreads like wildfire because of the rising costs and insurance turning down claims. And here's something that not only works for the common person, but the chiropractic as well, bringing in more customers due to that viral aspect.
Yeah, let me add the one story that is a great illustration, but this was a Scottsdale family spending $2,300 a month on a Cobra plan because mom lost her job. And the 16-year-old daughter had a kidney disorder, spending $180 a month for one script. They joined Impact and their premium went from $2,300 to $628. Wow. The drug went from $180 to $14. That's when Trey and I started looking at this more as a financial instrument, because we're now repurposing disposable income. For that example was something like $22,000. Now we're advising them to go back to their insurance broker, their investor advisor. How can I deploy this money. And those are the kind of stories that we see on a regular basis.
Yeah, what I think is interesting about Impact Health and really our journey together, guys, is when we originally came up with the concept of Impact Health, we had information sessions, we invited people in, and there was people that were curious. Oh, I've heard these things before. Maybe they've had bad interactions with these type of services when they're under other companies or the other ways that they were administered. One of the things I hear over and over again from chiros who are using Impact Health is how incredibly intuitive and easy it's been for them to work
Yeah.
with Impact Health. It's not, there isn't dogma issues, there isn't processing issues. It truly is what you get. And it's part of being a part of a larger community that I think is really assisting. Can you guys talk a little bit more about, from an education standpoint, you enroll in Impact Health, you're interested in it, you're maybe even interested in evangelizing Impact Health out to patients and colleagues and what have you. What kind of education is available through Impact Health to really equip people who want to share about what they've learned and the benefits that they're reaping from Impact Health?
Yeah, I gotta say the Impact Health Sharing website is just loaded with information about going to the doctors, how you get pricing, everything. Like you said, it is seamless. You don't need to go to the broker and look at the gold tier premium insurance compared to the silver tier. It's just based off age of the oldest family member. Here's your premium. You enroll right then and there. You don't need to do a medical physical to see pre-existing conditions. It's just a short quiz when you enroll. And then everything, and literally everything, is on the website. If you have any questions, you can reach out. A real person answers the phone. You don't have to do that robot voice just to get the person online 15 minutes later. So my dad and I guinea pigged ourselves about 3 years ago with Impact just to see what it was like. We both use it as our main healthcare now, and it really has been seamless. And I don't want to say it brings the fun back into it, but it definitely doesn't put the burden of looking for new insurance, or I don't have to worry about my premium going up 12% this year because they haven't raised their prices in 6 years, which is wild.
Yeah, it's the ease that Trey's mentioning. It really is that easy. To highlight some of the features there, you can price up to 3 people, but if you have 12 kids, it's still the same premium. So when you have the one deductible per family, that is huge. And the average savings that we see is about 50%, if not more. So you're going to be cutting your healthcare costs in half. Another feature this year, through their nonprofit status, their prescription drugs are wholesale, but if it's under $10 with Impact, it's now free. So they
Wow.
continue to it's really that.
They added a dental and vision savings pass. And my personal favorite benefit that they brought in this year was the health and wellness credit.
Yes.
Which basically is you can put $150 a month towards your deductible on things like gym memberships, supplements, cryotherapy, acupuncture, anything.
Chiropractic.
Yeah. So anything holistic that's going to keep their members more healthy, they will put that towards the deductible, which I think speaks volume of how much care they have for their customers, and they want them to stay healthy, and they want them to go work out and get that supplementary membership, which we took a look into other health sharing platforms, and nothing compares to Impact.
So that wellness credit, that's taking $1,800 off annually for something as simple as supplements. But it's really, I think, progressive on their part.
And it just makes sense, right? If you're really about health, it makes sense to make that a cornerstone of it, that the personal responsibility is part of that. One of the things that is interesting, people are going to say, hell, you guys missed open enrollment. And the truth of the matter is that there is no bad time to enroll into Impact Health. And I really feel that open enrollment is one of those processes that needs to evolve anyways in the larger landscape, because it is crazy that they, especially this year, when premiums are not known quite yet, you're expected to choose something based off of not actually knowing what the impact of that cost is going to be going into the new year, which is, I wasn't born yesterday, but that feels a little uncomfortable knowing that you're signing into something, locking yourself into something that may dramatically change and impact, I think you said, Richard, discretionary income it's not so discretionary when you have a family to support.
Yep.
And so not knowing what your bottom line is going to be is very difficult. Can you guys speak a little bit more? And Trey, you had mentioned that they've not raised their costs, their prices in 6 years, but talk about why that is. Why is Impact not impacted by the trends that we've been seeing of late? And why does the business model lend itself to not having that up and down price hikes?
Yeah, at the end of the day, it's because they're nonprofit status. There's no middleman reaching their hand into the pockets to get that prescription drug or that surgery procedures. They also use something called reference-based pricing, which is a practice that's taken at a lot of places around the country, where they basically look at the price of a procedure or surgery and they go, that's not the correct amount. If it's 17,000, that's more like 10,000. So they can reprice the amount that they're going to pay the provider. Because they pay within that 15-day mark, providers are like, we'll just take it. We don't want to wait 3 to 6 months to get paid. And they know they're overcharging. Insurance companies overcharge due to make profit. So that's the biggest reason why they can keep stuff so low. And they're trying to keep their members healthy. If members are healthy, they're not going to the doctors. So that pool that everyone's pushing in with the community-based sharing, that just keeps growing and growing, which is why last year or this year, they brought in 3 new benefits: prescription drugs, the dental and vision pricing, and the health and wellness credit. So we're super excited to see what 2026 is going to bring benefit-wise, because they're always mixing up something new for us.
Richard, do you have anything you want to add to that?
As Trey mentioned, as the fund grows, that's where these new benefits keep coming out. So it's really a trajectory that they're trying to keep improving. So it's a matter of, as Trey said, we're excited to see what 2026 is going to bring, because when you do a fair comparison between traditional healthcare and Impact, co-pays, pick a subject. So it's continues to grow.
Richard and Trey, you were just sharing with me before we got on this recording that there's a brand new feature that Impact Health has brought in, and it's teletherapy. Can you give me more information on that?
Absolutely. They're now wading into that mental illness category, which is fairly unusual. And this is a 24/7 free, love that word, free, teletherapy, which is a flexible short-term therapy support designed to care for your whole well-being. So you're allowed 3 visits per month, and it can be on depression, suicide thoughts, anxiety, a myriad of topics that fall into that category. And I guess it's testimony again to them saying, we're becoming more of a wellness company as well as an alternative to traditional healthcare. And I think that's really, really exciting.
Yeah, and if you don't want to do the telehealth and you want to go to outpatient or go to your specific therapist, Impact says you can do it 5 times, that would be eligible to share. So you've got best of both worlds. You want to stay inside or go see your preferred therapist, both are great options, and Impact allows it.
Doctegrity is the Life Vital app powered by that platform, which allows members to measure blood pressure, heart rate variability, cardio workouts, mental health issues, and so much more. That will be introduced in 2026. So we'll have more details for you on that as well.
That's great. So it'll be some form of an integrated app that allow for them to monitor.
Yes.
Wow,
Yep.
That's fantastic. Yeah, when we get more information on that, please share that. Rich and Trey, as always, I really enjoy our time talking, and I really appreciate what you're doing on behalf of making insurance accessible to chiropractors and small business owners. What are your last thoughts? What is one last thing that our members are going to need to know about Impact Health? Richard, do you want to go ahead and start?
Yeah, we'd like to keep it simple because it is. And if you just think that it looks and feels just like traditional healthcare, it really does. You get your membership portal, which is awesome. So you see what your dollars are doing. You're seeing what they're paying. You see the size of the fund. So it's this total transparency where you just don't get that with traditional healthcare. And the other benefits are endless, but the website speaks for itself. The testimonials on the website will tell a whole different story. You're going to go like this. So Trey,
Yeah, Mike, I just got to say, Blockbuster, Netflix, taxis to Ubers, traditional healthcare to Impact Health. Times are changing, and this year specifically, there's a lot of pain going on in the insurance world, and 85% of families that go bankrupt is due to cost of insurance. So if you don't believe everything we're saying, just check it out. Go online, check your pricing, see how much money you can save, and really see the benefits of switching to Impact and changing your life around and trying something new.
Trey, Richard from Impact Health Sharing, I really appreciate you guys both being here and sharing with our members all the benefits that are available to them. And it just seems like Impact Health is constantly shifting and changing and bringing on more opportunity for their patients, which I think is fantastic. On behalf of the PCA, thank you for being a strategic business partner of ours. We look forward to seeing you at our conference coming soon, and take care.
All right, Mike, thanks.